My role is an advanced practice physiotherapist in respiratory care. The Moving Forward Together programme is looking at how best to deliver healthcare resources in the future. There's no doubt that the health system can't cope the way that it is. We've got an ageing population, we've got more complex conditions, we've got patients who are living longer and are going to have 2, 3, perhaps 4 more chronic conditions that they're going to have to manage in the future. This obviously puts a huge burden not only on the patients but on the current healthcare system. We need to look at how these services can be provided differently. Patients need to have access and support to people who are going to care for them. They need to be educated in their condition and how to look after it, and we need to try and look after these patients in their home. There is no doubt that being looked after in your own areas, in your own surroundings, is much better than coming into hospital. The community respiratory team can manage patients at home. We can either pick them up from referrals from our own specialists in hospital, or we get referrals from GPs that they think these patients are needing some sort of intervention. So in outpatient clinics we can offer non-pharmacological intervention to patients. Basically this means anything that we can do that doesn't mean medication based. Medications are great, they control conditions, they control symptoms, however they can offer also significant side effects. Controlling these things by offering physical means such as advice on exercise, advice on chest clearance to be able to clear mucus and phlegm from patients' chests to help them breathe properly and to reduce infections is all part of the strategies that we would employ. Patients tend to like this because then we can educate them how to look after themselves and how to empower them and to know when they might be deteriorating. So then they can employ some strategies that we've taught them that would perhaps stop them looking for medication or having to go to their GPs or their pharmacist. We're also looking at the use of virtual clinics, which perhaps may reduce the number of patients' visits up to hospitals. So for example, there's no point in a patient coming up to a clinic to get good news that all their test results are negative. So perhaps we could look to phone these patients and keep them on our books on a more regular basis through telephone consults or perhaps webcam chats, etc. in the future, rather than patients having to get 2 buses up to come to hospital. So the future of care is got lots of changes ahead of us, and hopefully our patients will be able to embrace that in the future also.